Hey guys, Anya back again with Companion Health, talking to you today a little bit about hormone replacement therapy and its use in menopause. I'm actually going to make two separate videos. This first one I'm going to talk about today is actually the FDA approved indications for hormone replacement therapy, and a separate one I will be talking about the types of hormone replacement therapy, risks and benefits, etc. So stay tuned for that one. So first off, you have something called vasomotor symptoms. These are the biggest kind of class of symptoms that people have related to menopause. Hormone replacement therapy is actually the first line therapy for relief of these menopausal symptoms. The biggest one everybody thinks of with these would be hot flashes, but it can also include diminished sleep quality, irritability, difficulty concentrating, decreased quality of life, and just an overall poor health status. And this overall poor health status seems to be linked to the cardiovascular risks, bone, and then cognitive risks that we see in untreated menopause. Next up would be prevention of bone loss. So talking about trying to prevent osteopenia or osteoporosis. This actually happens through something called inhibition of osteoclast-driven bone reabsorption and a decreased rate of remodeling, which essentially just means that when your hormones are balanced, you have these things called osteoblast and osteoclast, and they're basically balancing how hard is your bone. And when your hormones, specifically your estrogen, testosterone, and DHEA, are all in balance, then it's nice and happy. You aren't losing bone density. This bone protection does appear to be dose dependent. So after you stop hormone replacement therapy, that actual bone protection does dissipate. Of note, oral contraceptive pills don't seem to offer much protection. This can be partly due because oral estrogen, which, remember, birth control pills are not actually estrogen, it's a chemical equivalent. But oral estrogen, so meaning, let's say you're on oral estradiol pills, can increase something called sex hormone binding globulin, which can decrease free testosterone, and testosterone is needed to build up bone. So just keep that in mind in case you have a provider that is telling you, oh, just keep taking your birth control pills, it'll be fine. Just understand there isn't as much bone protection with that option. There is an indication for what's called premature hypoestrogenism. So this essentially just means maybe you had surgical menopause, you had a hysterectomy early on, you had something called premature ovarian insufficiency, it used to be called premature ovarian failure. Indications for this would be menopausal symptoms, prevention of heart disease, bone loss prevention, cognitive and mood issues. And then there's another big group of symptoms called genital urinary symptoms. So these would be anything related to the vaginal cavity, bladder health, such as that. So indications for this would be to restore this genital urinary tract anatomy, increase superficial vaginal cells, basically try to plump the vaginal cavity back up, decrease in vaginal pH, or treat the symptoms of vulvovaginal atrophy, which is vulvovaginal atrophy is just the actual tissues themselves of both the vulva and the vagina are actually decreasing, which is leading to a lot of the symptoms, which those symptoms would be having vaginal genital dryness, burning, irritation. Urinary symptoms would be urgency, burning with urination, actually having urinary incontinence, having frequent UTIs. And then the sexual symptoms of that would be having diminished lubrication, pain, specifically pain with intercourse, and even just irritation after the fact. Estrogen therapy is the most effective for treating these genital urinary symptoms, and vaginal estrogen therapy is the most effective and safe, which in the next video we'll get into dosing and types of replacement in terms of safety, so just again stay tuned with that. But vaginal estrogen therapy actually increases the number of vessels just around that vaginal area, and it can improve incontinence and actually helps in term with the actual muscle contraction and relaxation that happens at the bladder. And then last but not least, the other FDA approved indication for hormone replacement therapy is joint pain. Estrogen directly will bind to receptors at the joint, which actually acts on the joint tissues and can protect their biomechanical structure and function. Basically, estrogen makes your joints happier. So again, recap of the FDA approved indications for hormone replacement therapy in menopause: vasomotor symptoms, prevention of bone loss, premature hypoestrogenism, genital urinary symptoms, and joint pain.